Hello, welcome to HealthLine. I'm Jennifer Blomquist. I have the privilege of hosting the program this evening, and I'm so glad you joined us because you will walk away tonight definitely learning something. I learn something new every show, and the other nice part of this program is that we welcome you to engage with us in the program. We keep the phone number up at the bottom of the screen, and we ask you to give us a call anytime through the program and ask a question. We have a urologist here with us tonight. We're going to talk about kidney stones, not everyone's favorite topic, but definitely something that afflicts a lot of people. He's come with a wealth of information to share, but maybe you have a question you'd like to ask him. You can get some free advice tonight just giving us a call. Again, the number we keep at the bottom of the screen, it's 969-2720. It is still a free call if you're outside of Fort Wayne. Just dial 866 in front of that and we'll put you through. You have the option of asking the question live during the show, which that's my preference because you can interact with the doctor. He may need to get more information from you to give you a better answer. Or the other option is that you can just tell the call screener what you'd like to find out, and they'll relay that to me and we'll get your question answered. Either way. So let's go ahead and meet our guest tonight. He has been a regular on our program over the years, Dr. Scott Palmer. Thank you so much.
Oh, more than happy to be here.
Appreciate it. You and I have done a program in the past about kidney stones, and
Yep.
you know, we hear about it. I imagine most people watching know at least a couple people who've had that. I've met, worked with a couple of my coworkers had it. I didn't realize how painful it is, though, until we had a coworker that had left to go have lunch. She felt fine. She worked all morning. And then she called us in a panic and said she couldn't drive. She was in such excruciating pain, and it seemed to come out of nowhere.
Yeah.
And it turned out to be a kidney stone.
Sure, yeah.
So I think some of us don't realize, if you've not had it or been close to someone who's had it, it can be quite an ordeal.
Yeah, I would say most people at least know somebody who's had a kidney stone.
Yeah.
They're very common. Statistically, 1 in 7 men in their lifetime will get a kidney stone, and 1 in 10 women.
Oh, wow.
And the pain's it's not a fun experience if you go through it.
Is that common, like my friend's experience, where it came on very suddenly?
Oh, yeah, absolutely.
Oh, okay. I didn't know, like, if there are warning signs you can look for leading up to it, or?
Not really. I mean, most kidney stones, when they try to pass, that's when they cause pain, and that can happen just randomly. And I've always told patients I think kidney stones are evil because they always pick the wrong time to try to pass. You're on a safari in Africa, and all of a sudden they're passing. But yeah, the pain can come on suddenly. It can be in the back or the front or the side. It can radiate, and it's what we call a colicky pain. So what's meant by that is no matter what you do, you just can't get comfortable.
So it doesn't come and go, it's constant?
It can be, but people that have them oftentimes will pace back and forth, and then they'll sit down, and they'll stand up and walk, and then they'll lay down and get back up and walk. They just can't get comfortable. Whereas a lot of pains you have, when you lay down, you feel better.
Right.
But with kidney stones, you just can't seem to get comfortable, and we call that colicky pain.
So if that happens and somebody has that episode, I mean, I assume they should probably go see somebody. I don't know if your primary care can handle that, or is that more of an emergency room visit?
Well, I think it depends on the severity. I mean, you've got people that have passed several stones in their lifetime, and so they may just try to ride it out, and then after a few days, if it's still bothering, they might call and make an appointment or contact us. And if the pain is really severe and you can't manage it, or it's associated with excessive vomiting or fevers or something like that, then you definitely should be in the ER. What
can they do? Because you had told me before, that some people just kind of ride it out if they've had it before. So if the pain's really bad, is there something you give them to make them comfortable, or is there something you can do to the stone? Well,
I wouldn't use the word comfortable.
Yeah.
You can try to take the edge off with pain medications, but to be honest with you, when it's really bad, pills are just not going to do it.
Okay.
And even the IV pain medications sometimes don't work well in really bad situations. But many patients, they kind of know the drill, and they'll take some medication to help it pass, which doesn't make a huge difference, but it does help at times. And like I said, they'll call if it's really bad or they just can't take it anymore.
Yeah.
But many people kind of have that routine they go through.
So do you, I assume this probably varies as far as the size and how long it takes to pass. Is that completely different each patient, or?
Yeah, it's a matter of probabilities. So basically the larger a stone is, the less chance it's going to move all the way into the bladder.
Okay.
But there are some people that can pass larger stones without a problem, and other people can't even pass small ones. And I think some of that is anatomy, some of that is just the muscle spasm and how severe it can be, where, even in a very small stone, if you have a really bad spasm, you can have severe pain and not be able to pass it. But the smaller it gets, the better your chances.
Now, I could have sworn years ago, the other person I knew who had it, it was a friend's husband, that I thought they did something to try and break it up.
Right. So as far as treating stones, so if somebody, let's say that the pain is so severe they can't tolerate it and they end up in the hospital, there's basically a few different options that we use. So one is to go from below with a scope and go up and remove it. And that usually requires a laser to break it up and then take the pieces out. There's also a procedure where you have a machine that's put up against your skin. It sends a shock wave through your body, and you try to target the stone and hit it over and over and break it up. The nice thing about that is it's non-invasive.
Right.
But the negative, though, is it's not 100% guaranteed either. So there are pros and cons both ways.
I mean, do most of the people, if it's really severe, does that require a hospital stay, or is it usually outpatient?
Yeah, sometimes. I mean, most of our stone procedures are outpatient.
Okay.
But we certainly do a lot of them inpatient as well. I mean, if they're pretty miserable, they'll get admitted and put on pain medications, and then we try to take care of it as fast as we can, either that night or the next day.
Yeah, I had heard it was comparable to the pain that people experience. If you didn't have any pain medication during childbirth, that it can be that.
Yeah, I think sometimes it can probably be like that. I mean, it varies. I passed one myself 20 years ago, and I worked the entire time. It took me 6 days. But it wasn't horrible. I could manage it. Yeah. But every situation is different.
Well, so it sounds like it's a little, you said 1 in 7 men will probably experience it versus 1 out of every 10 women. So correct, is there something about male anatomy or is it lifestyle?
Well, I don't think they've ever actually elucidated why there's a difference there. My guess is it's probably a combination of things. It could be activity and sweating and being outside. It's hard to say whether there's actually a sex difference in terms of genetics.
Okay. How about age? I wonder, is like
all ages.
I was going to say, the people I knew were younger. I was shocked. I thought it was something you experienced older.
I've seen all ages. Okay. And the incidence is actually getting worse. Oh. Yeah. So if you look across the world in developed countries, the prevalence of kidney stones is going up and up and up. And some people think that part of that is just increased by chance diagnostic studies. We're doing more and more CT scans and things like that. But actually, many of these studies were based on hospitalizations, so that wouldn't necessarily explain that. So we do see that the rates are going up amongst both men and women and across many developed countries.
All right. Well, I have lots more questions I want to ask you, but I'm hoping that somebody watching will have some questions. Again, this is Dr. Scott Palmer. He is a urologist, and we're talking about kidney stones. If you have any questions about that or something urology related, please give us a call. Again, that's why we keep that phone number at the bottom of the screen, 969-2720. I was wondering if there's anything you can do to avoid getting a kidney stone, especially if you've had one, avoiding a repeat episode. So.
Yeah, there's what I call strategies, that you can follow, but there are some people that do all the right things and they can still get kidney stones. But in terms of other strategies, you can try hydration, number one. That's, almost all kidney stone forms benefit from increased hydration.
Is any particular kind? Is water the best solution?
Water is certainly great, but I tell patients to focus on the word hydration. So really, anything that you drink that doesn't have caffeine or alcohol hydrates to some degree. So even things like decaf tea, decaf coffee, even decaf pop. There's a lot of what I would call urban legends out there about what causes kidney stones and what people should do. And some of those are true, many of them are not true. For example, you'll hear that colas and teas and coffees cause kidney stones, but that's actually been disproven. Okay. But you hear it all the time.
I'm glad to hear that.
Yeah, and even pop, I think pop's not a great thing to drink all the time, but in terms of causing kidney stones, probably in most cases not.
Okay. Do you find that it tends to be hereditary?
It can be, absolutely. Okay. So probably the biggest risk factor for developing kidney stones is a strong family history.
All right. And does it necessarily, I mean, if you have them once, are you doomed to have it again if you don't make some changes?
Your risk is higher, absolutely. So if you compare yourself to the general population, if you've had one, there's about a coin flip chance you're going to have another one within 5 years.
Oh, that soon. Okay. Yeah. Oh, that's not what I wanted to hear, but I'm glad I know it. So I'm going to go ahead and read the question here that we have from somebody who called in. James, I think, called in and wants to know what's the difference between a kidney stone and a gallstone. That's true. I don't hear about gallstones as much as I do kidney stones.
Yeah, I mean, they're both very, very common. And for the most part, they're not really related.
Okay.
Even though they're both stones. There was one study maybe 15 years ago that showed there might be a slight association in terms of when you get one, you have a higher risk of getting another. But I think that probably has more to do with medical issues, like diabetes, obesity, things like that. But the difference is basically where they're formed. So gallstones are formed in the gallbladder. They can sit there for a long time, just like kidney stones, and then one day try to pass. And that can lead to all kinds of abdominal pain, especially after eating a big meal. Whereas kidney stones, the chemistry is very different in terms of how they form. But there's a number of risk factors, whether it be genetic or dietary or sometimes medications, that can trigger kidney stones. And gallstones have some of the same risk factors in terms of diabetes, obesity, things like that. There's risk factors for both.
With a gallstone, is there a difference in pain? I wondered.
Yeah, interesting. We talked about the colicky pain, right, where you can't get comfortable. They both kind of have that. So those are really two good examples of that. Whereas gallstones, they oftentimes have what we call a crescendo effect, meaning that the pain kind of gradually kind of comes on, it gets worse and worse and worse, and it reaches a peak where you're just miserable.
Yeah.
And usually the pain is in the belly area.
Okay.
But you can't get comfortable, just like kidney stones. So you may be pacing back and forth, and then it starts to kind of subside, and it's that what we call crescendo. Whereas kidney stone pain may come on much more suddenly, but they're very similar in the sense you can't get comfortable
the whole time. I wondered, since you can remove your, you can live without your gallbladder, you can have it removed. So if, whereas unlike with a kidney, I don't think they'd want to remove it unless it was dire. But is that a solution with the gallstones? Do you consider that if it's happening repeatedly?
In terms of taking the kidney out?
Or in terms of taking the gallbladder out?
Well,
I wonder,
we don't do that surgery. That falls under a different field. But always, certainly, if people are having several,
I don't know if you recommend it. Yeah.
Well, if they're having a lot of gallbladder attacks, taking a gallbladder out is a common way to treat that. Absolutely.
Yeah. Okay. Yeah. Just curious about that. So they both sound terrible, but the one at least you could live without. The gallbladder.
Right.
So you talked about the laser, trying to break up the stone with the laser. Besides that, you talked about drinking a lot of fluids, but are there any other treatments or things you can do?
Well, I mentioned the one from the outside, which is called extracorporeal shockwave lithotripsy.
That's true.
Yes.
Yeah.
And that's a technology that was developed, I believe, in Germany back in the 70s.
Okay.
And it's become worldwide extremely popular. And patients like it because it's non-invasive, and it does have a high success rate. But it's not perfect. And I always tell patients that even if a stone breaks up well, you have to understand that the pieces are still there and they still have to pass, and so they can cause trouble. But it is a very, very popular treatment. And then, of course, the scope with a laser, also very commonly done. I mean, we do them literally every day. And whether you do one versus another depends on several factors. It depends on how big the stone is, where it is, patient factors. And there's other surgeries as well. There's one where we go in through the back with a small incision, actually go into the kidney and break up stones and pick out the pieces.
Oh. What kind of instrument do you use to do that?
There's a few different instruments. You can use a laser in that procedure, but the most commonly used instrument is one that actually, it's called an ultrasonic high-frequency vibration, but it also has a hammering effect and a suctioning effect. And so you're actually kind of trying to break the stone up and try to suction out the pieces. But you can use other things like the laser, or you can even use what are called graspers to go in there and pull them out too.
I mean, does your kidney tend to function okay after an experience like that, or does it? I wonder if it has to heal, or
well, it has to heal. I mean, you're poking a hole in the kidney, so I mean, it's going to bleed, and there's definitely trauma to the kidney. But in terms of kidney function afterwards, no, it'll heal, and generally kidneys rebound just fine.
All right, good to know. I just want to remind everybody one more time, we only have about maybe 10 more minutes left. The show goes very quickly, so give us a call if you have a question. I hate to miss answering one of your questions, giving you some free advice tonight. Again, the number at the bottom of the screen, it's 969-2720. Is this something that can be handled by a family doctor usually, or especially if you're having it repeatedly? Do you have to go to a specialist?
Well, I think For most people, if you're having them repeatedly, you're better off
Yeah.
seeing one of us.
Okay.
Now, nephrology, which is the medical field that
Yeah,
treats kidneys,
right.
they also can run some tests and try to look for causes, and so there's an overlap there.
Yeah.
But in terms of managing kidney stones, that's going to fall more under our field. Primary care certainly can help with symptoms.
Okay,
You know, somebody calls up and they say, "I'm passing a stone. I'm just totally miserable." You know, they can call in some pain medications. But in terms of actually managing them, they're better off seeing us.
And then what about just long term? Does it have, you know, if you deal with this repeatedly, does it impact other systems in your body, or do you end up having other issues down the road? I wondered if like you were a better candidate for maybe something like cancer down the road, if that had any impact on it, if you have this happen.
Well, I don't think kidney stones by themselves have ever been found to be a risk factor for getting cancers or things like that. Now, there have been studies showing that people who have been treated for cancer, that have gone through chemotherapy or whatever, have a higher risk of getting kidney stones.
Okay.
So that's been shown. But in terms of actually causing cancer or leading to other kinds of diseases, I don't think there's a lot of evidence for that.
Okay, yeah. I just was curious. When you talked about nephrology, I always think about nephrology being really serious kidney issues, you know,
Well,
that you would start with a urologist and then the nephrology, I always associate that with kidney transplant
the
patients.
best way to think about it is we're the surgeons and the plumbers, whereas they're the function doctors.
Okay.
So they deal with things like, you know, kidney failure, or when the kidneys are causing other issues like hypertension and things like that. So we do overlap on many areas, but really we're the surgeons and the plumbers, and they're the function doctors.
Do you find that there's a lot of research going on right now to try and help people who deal with kidney stones, or finding different ways to deal with it or treat it?
Yeah, I mean, I think there's always stuff that's kind of brewing out there.
Okay.
But in terms of actually treating kidney stones, the technology gets better all the time. But we haven't found that, you know, that magic pill that's going to just keep them away.
Yeah, that would be nice.
It would be nice.
That would be great. Maybe someday. We did have somebody who called and wanted me to ask the question for them. I don't have my contacts in, so I've got to look at the closest camera. Let's see. Can making too much drinking too much mineral water cause kidney stones?
And that'd be Stan, I think is right.
Yes. Yeah.
Yeah. So Stan, that's actually a really good question. I get that a lot of times. Especially people who have well water, you know, they'll wonder if they're drinking too much well water causing kidney stones. I think for the most part, there hasn't been really any evidence of that happening. I think mineral water, or, you know, water that's high in minerals, or well water is probably fine. I certainly would not recommend avoiding it just because you're concerned about kidney stones. Again, hydration is the key, and generally minerals in the water are not going to cause kidney stones directly. But that's a common question. I get that one a lot.
You know, Stan, I'm glad you brought that up. That made me think of something else that I feel like with all the Health and Human Services Department right now kind of opening our eyes to things that are in, you know, products that we consume.
Absolutely.
You know, yeah, I didn't think about that. Like if well water, you know, because I know really if you have well water, we've taken ours in to be, you know, checked by like the extension office, you know. But other than that, you know, it's not really monitored. It's up to the homeowner, you know.
Pretty much,
Is water softener, does that make any difference?
Not that I've never seen that.
Okay.
But there's been many things throughout the years that have kind of come up as potential, you know, contributing factors. I mean, for years they thought dairy products, you know, calcium, you know, cut back on calcium. And actually what we found is, for many people, that actually makes it worse.
Does it? Okay.
Rarely makes it any better. You know, and people, like I said before, you know, people think that pop causes kidney stones, or coffee, or teas. So there's been things that have kind of become ingrained in our society that are not necessarily true, but, you know, we're learning all the time, you know, what things, you know, really are contributing factors and which ones are not. But for many people, you know, you can't necessarily pinpoint it. I mean, for many people, it can be something kind of just nebulous. You can't really figure it out. But I tell patients you can only control those things you can control. So you can control hydration. You can control how you eat and when you eat, and those kinds of things. But there are some people that do all the right things and are still going to get kidney stones.
Yeah. No, I understand that. I was curious too. Have you ever heard of a pediatric case involving?
Many times. Yeah.
Really? Okay.
Sure.
Now I have a lot of kids. I've never heard of that.
Yeah.
So,
I think the youngest that I've done a procedure on was 4.
Wow, that's pretty little.
Yeah.
And were there other issues, health issues with the child, or can this happen to a perfectly healthy child?
No, I don't think in that case there was. I mean, I've treated many children over the years with kidney stones, and certainly when they develop kidney stones at a young age, that's a red flag, because it's probably not a dietary thing. So anybody who's really young that gets kidney stones, I do recommend that they go through what we call a metabolic evaluation, which is primarily a 24-hour urine collection and looking for causes. But somebody who's gets their first stone when they're 55 or 60, that could be something dietary, or it could be medically related. But at a young age, that's a red flag.
Yeah, that would be horrible to think of a child going through that too. Do you do any different treatments with a younger patient?
Not necessarily.
No?
I mean, I think the options are still the same. Obviously, though, with kids, sometimes the instruments have to be modified, or you have to get special instruments. But for the most part, the options in terms of how you treat them is going to be about the same.
Okay, all right, yeah. I'm surprised. I've never heard of that before, but obviously it does happen.
Absolutely.
So, what about long-term, as far as some of the patients you've seen? Have you seen anything where somebody's really turned the situation around? Maybe somebody who's had a few kidney stones, and maybe they made some significant life changes, health-wise, diet-wise.
Sure. Yeah.
Because some people may. I would start getting really down in the dumps if it was happening repeatedly, and so I don't know if you have any words of wisdom there.
Well, what's interesting about it is that there's a certain irony that some of the healthiest diets are probably some of the more riskiest diets, and it's kind of that catch-22 situation. Yeah. People that come in and say, well, all I eat is nuts and greens, and it's like, well, maybe that might be the problem.
Yeah.
So being healthy is not necessarily going to fix kidney stones, but people that get control of other health issues. So they lose weight, they get control of their diabetes, they hydrate. Absolutely, people can turn things around.
Yeah, there's such a, there's all those different diets. They have all the different names, fad diets, I guess you would call them. But, I meet a lot of people these days who just are plant-based diets. I don't know if you recommend that or not, because I'm just thinking the protein, especially for children.
Every situation is different.
Yeah.
So if somebody has a certain special diet, you run some tests and see if maybe that might be contributing, but in many cases it's not. So it's not always a dietary thing.
All right. We just have a couple of minutes left, so we could squeeze in a real quick question if you want to give us a call. It's 969-2720. Again, it's Dr. Scott Palmer, who's a specialist in urology. I was just wondering, I forgot to ask you earlier when you talked about the stone once it passes and gets into the bladder.
Right.
Are you out of the woods? Or does that still cause pain when you're at that point?
No, typically once it's in the bladder, you're going to be out of the woods. Now there are rare cases where it gets caught coming out, and that is a common misconception. So that's actually a good point. So when we talk about passing a kidney stone, we're talking about when it goes from the kidney to the bladder.
Okay.
It's not typically when you actually pee it out.
So does it, is it smaller by the time it gets into the bladder? Is it size sometimes reduced by that point?
Not
or what
necessarily.
Happens to
the
it?
size usually stays about the same. Now, there are rare times where they'll break up on the way down, but usually it's about the same. So where it started and where it came out, they'll be the same, because they're pretty firm. They're like rocks. So they're not going to change a lot.
Yeah, do people, I don't even know if people have to show it to their doctor to be measured. Does that help you at all?
Well,
if you can see it?
It's not necessarily going to help in terms of planning, no, but I think it's always something that patients like to see. I'll take pictures of their stones.
Okay.
But there are times where you'll go in there and you'll find it laying in the bladder. I just had that happen Friday.
It was just in there.
Yeah,
okay.
Yeah, it happens. The patients are passing a stone and they don't realize it's already passed in the bladder, but they have surgery and there it is.
All right, that's interesting. I would not. I'm like the same after oral surgery. I don't want to see my teeth or anything. I'm good not seeing it.
It depends on the patient.
It's true. We're going to quickly try and get one in here. This was someone, Dave called in, wanted to know if doctors will use lasers or I can't read the next word. Okay, couldn't see the first part of the word, to treat kidney stones.
Absolutely, every day.
Okay.
I mean, those are the most common treatments that we do for kidney stones. There's other surgeries that we do, but boy, every day we do that. I mean, it's literally every single day.
Yeah. It sounds like it keeps you pretty busy.
They keep us busy.
Among all the other things you do. So, all right. Well, thank you so much, Dr. Palmer. Great to have you back on. I appreciate all your expertise. And yeah, I tell people you're going to learn something no matter whether this is an issue you deal with now. I mean, it helps to know in case something happens down the road or to you or to a loved one. So thank you so much for all the folks who called in tonight. Really appreciate that as well. And we are done for this evening. I'm Jennifer Blomquist. Take care. Have a great week. And we hope to see you back here next week for HealthLine. Take care.
PBS Fort Wayne was made possible in part by
Momentum, progress, innovation. Parkview Health knows standing still isn't an option. We must learn, grow, excel, and actively work to advance healthcare for our community and beyond. With technologies that improve access to care and teams of specialized providers, we are moving healthcare forward. Right here at Parkview Health.